Good evening, everybody. Taking care of Instagram first. Right now. Keep let folks know I'm going on. Get started in a minute. How's everybody doing? We're gonna start in 1 minute. I'm just give folks an opportunity to log in. So get started in a minute. Hey, Mom, I'm live now. Good evening, everybody. I'm not gonna start right away. I just want to give folks an opportunity to log in. Just to talk a little trash before we get started today. I'm going to do a podcast probably one day this week. 444 podcast, which is a Philly sports podcast, led by a good friend of mine. Probably gonna do that podcast this week to talk about The Last Dance, the Michael Jordan documentary. A lot of folks know I'm a big basketball. Yeah, look at my shirt. So I'm not gonna waste too much time talking about that. I'm probably gonna go live. Do a podcast about that later this week. So for those who want to jump into some conversation about that, look out for that later this week. I'm not gonna really dive into that right now. We have so many different things to discuss today. So many different things going on. I want to give folks a couple more minutes to log in. If you have any questions, if you're on Facebook or Instagram, if you have any questions or comments, feel free to go ahead and put those in now. My staff is watching as well, so any questions, any comments, anything you need us to answer, go ahead and put that in now, and my staff will interact and answer that as we go throughout the course of the night. Other than that, gonna look to get started. I know folks are doing a lot of interesting things to try to make sure that they keep themselves busy. One of the things that my staff and I have been talking a lot about is the mental health side of this. I don't want anybody who feels like they're in a position where as though you're struggling with this mentally to feel like you're alone. A lot of folks are struggling mentally to get through this during this time. It becomes a lot to sit in the walls, to be around the same folks. I know some folks, Danny, good evening. How are you? I know some folks, are by themselves, which makes it a little more difficult to deal with this. So for people who are struggling mentally, know that you're not the only one. One of my staff members is on the Facebook side. I recently produced an op-ed to talk about the mental health side. If somebody on my staff can put that op-ed in the comments section, I definitely appreciate it. If somebody can put that op-ed in the comments section, I definitely appreciate it. And we can make sure, I want folks to read that so folks know that the mental health side is real. Outside of that, the mandatory mask component is definitely real too. If someone could also put the podcast that I did with Sherry Gregg, shout out to Sherry. She did an awesome podcast where we had a conversation around just the psychological side of wearing a mask. If somebody could put that podcast in there as well too. Just so those are like other dynamics that we're dealing with indirectly because of Corona, right? So because of Corona, now we have to wear a mask, which is something that I talked about from the perspective of Black men. And then now because of Corona, we're also dealing with this whole mental health side and social distancing and what that does as far as not being able to come in contact and communicate with people. So I'm going to go ahead and get started. Those are just two things that I thought would be good for the audience. And again, if you're somebody that's struggling in that area, know that you're not the only one. So today we had 339 new cases. We had 5 unfortunate deaths. We had 5 unfortunate deaths here in the city of Philadelphia. That puts us at a total of 9,553 total confirmed cases in the city of Philadelphia. It also puts us at 370 total deaths. And overall, here in the city of Philadelphia, we've tested 21,767 people. And so when you look at that number, our population in the city of Philadelphia is about 1.5 million. We're still getting to the point where we're trying to test a lot more. So the biggest issue that we have right now, not just as a city of Philadelphia, but in places all across the country. The biggest issue we have right now is we really need to increase our capacity to test more people. We need to increase our capacity to test rapidly. In order for us to put ourselves in a position where this can actually be a thing, we need support from the federal government. So if you're somebody who is wondering what can you do, how can you help, one of the things that you can do to help right now is to lobby the federal government. Call your member of Congress, call more or less Republican members of Congress, encourage them to give cities the money that they need, provide cities with more testing so we can increase our testing capability. I'll continue with city stuff, then I'll do state and federal stuff, and then I'll look to close out. So on the city side, one of the issues that we're running into in Philadelphia is some of our issues around water and sewage. Where we are right now as a city is because we're collecting a lot of wipes and a lot of like gloves and things like that. We're seeing an increase of like gloves and cleaning items such as sanitation wipes being flushed down toilets, and it's creating a cloggage in our sewer system here in the city of Philadelphia. So if you're like most Philadelphians and you've increased how much you wash your hands and you increase the number of wipes that you might use, please make sure that you throw those things in the trash. Please do not flush those things down the toilet. We're going to create a whole nother problem here in the city of Philadelphia where we're going to see a backup in our sewage system. And for you as an individual homeowner, that's going to end up costing you more money. So again, if you are like most Philadelphians and you've now purchased more wipes and more gloves, again, please don't flush those cleaning items down the toilet. Please do your best to make sure that those things are disposed and they're in the trash. And that's an actual issue that we're facing in the city of Philadelphia. I haven't spent much time talking about what's going on with the prisons, and I'll be honest with you why. I'm at the table. I have a great relationship with the public defender's office. I have a great relationship with the district attorney's office, and my team, we've been doing our best to try and help as far as advocacy with releasing people from the prisons. And so just so you understand what we're saying, we're talking about people who are not a risk to the general public. We're talking about people who did not commit violent crimes, who are in danger because of not just hurting all of themselves, but hurting all of us if we were to see a fluctuation of confirmed coronavirus cases in our prison systems. And so we've been working closely with advocates all across the city. Big shout out to Ruben Jones from Frontline Dads. We've been working closely with advocates across the city to the best of our ability, responsibly release people from prison in order to not just save their lives and other prisoners' lives, as well as those folks who work in the prison, but us as the general public. And so if anybody needs an update on what's going on with that, I know we've seen a few questions, but not that many. You can feel free to reach out to our office and we'll tell you some of the steps that we're making. And again, someone committing a crime like theft or robbery, they shouldn't be sentenced to death by being exposed to COVID-19. On the other side of that, right now in the city of Philadelphia, if you do commit a serious crime, you will be prosecuted. You do not want to commit a serious crime in the city of Philadelphia. I don't want folks to think that because we're letting people out of prison that the criminal justice system is susceptible to an increase in crime. We unfortunately have not seen a decrease in gun violence here in the city of Philadelphia. I talked about that last week. Hopefully we can get to the point where we will see a decrease in gun violence in the city of Philadelphia. But until we get to that point, we're going to continue to advocate against it. But meanwhile, again, just because we're in a coronavirus crisis doesn't mean that folks won't be prosecuted. They absolutely will. And just because we're releasing people from prison don't mean folks won't be incarcerated. Outside of that, the schools. So schools are still giving out Chromebooks to students that need them. For those who ask what happens with students' grades, what the school district ended up doing is the school district had a decision that they had to make as far as how do they close out the school year. And so what the school district of Philadelphia has decided to do was keep the third marking period open. So young people right now, instead of traditionally transitioning into the fourth market period, they've kept the third market period open. They've kept the third market period open. And what the school district is trying to do is use this final few months as an opportunity for young people to improve their grades as it relates to the third market period, learn new content, of course, and have an opportunity for young people to finish the actual grade, and that be 3 marking periods. So again, the School District of Philadelphia is looking to have 3 marking periods this marking period instead of the traditional 4th marking period that we often see. And the goal with that is to put young people in a position where they don't have to repeat the grade. They can transition into the next grade. The trash pickup schedule has changed as well too. So if you don't know, there have been some changes as it relates to how trash pickup happens in different neighborhoods. So recycling pickup won't happen every week. They'll happen every other week. And when we look at what's going on with trash across the city, my office, me as the chair of the Streets and Services Committee, we are talking to different branches of government to figure out how can we assure that the city stay clean during this time. With that being said, last thing on the city side, there will not be a city council session this Thursday. City council actually has not met in weeks. We are following the governor's stay-at-home order. We are looking at having a possible city council session at the opening of May. I'll keep folks posted about what that looks like. But as of right now, city council is still suspended as well, too. And the mayor's budget, his original budget address to city council that happened a couple months ago, that's pretty much scratched now, clearly because of Corona. And the target date for the new address for the mayor, where the mayor gives his address to the city as far as his budget pitch and what his priorities are going to be. Right now, we're looking at May 1st for that date. So that's not etched in stone, but that's what folks are looking at right now. We'll see if that's the actual date. Take a couple minutes to get some water. If you have any questions or anything like that, feel free to put your questions down. Okay, on the state side, Harrisburg decided to, the governor had a press conference today. And at the press conference today, the governor talked about the extension as far as the stay-at-home order here in the state of Pennsylvania. He also talked about a very, very, very slow rollout of businesses opening. He only named 1 or 2 businesses, wine and spirits, specifically here in the state of Pennsylvania, and car dealerships, looking at those facilities being open, car dealerships being open in May. We know, based on the governor's order, that we'll be home at least until May 8th. I anticipate it being longer, as I've said for some time now, but we know based on the governor's announcement today that we can anticipate being home at least until May 8th, but that will probably be extended even past May 8th. So be on the lookout for that. And as we get more information, I'll make sure to share it with the collective. Huge shout out to Councilmember at Large, Catherine Gilmore Richardson. For those of you who have questions about state unemployment stuff, she's doing a great event on Thursday where you can be a part of a conversation with her, as well as State Rep Jordan Harris, and they will be holding a conversation around unemployment. I know another number of folks have applied for unemployment here in the state of Pennsylvania. If you're struggling with unemployment, there will be a great teleconference this Thursday. We'll make sure to give you that information if you're curious. And thank you to our state partners for that leadership. Before we go into the federal side and close out, I just want to take a minute to give folks some information about elected officials. And so I know often people are wondering what we're doing during the coronavirus. And so what folks, don't know is for us as elected officials, this is an extremely difficult time like it is for other people. Of course, as individual human beings, we have families and lives and things like that. So we're dealing with our children and our parents and things of that capacity. But then outside of that, we spend a lot of time on calls. And so for me, just this past week, just so folks know that we're actually working because we represent you. And so this past week, we had a call where us as city council had a dialogue with a lot of our representatives in Harrisburg, right? A call like that, over an hour long, easily, because we want to try to figure out how can we collaborate to support those who need us the most. We'll have a conversation with our federal delegation, again, over an hour, trying to figure out how can we coordinate and support. We'll also have a dialogue with, our legal side, which is our district attorney, our public defender's office. We'll also have conversations with judges. We'll be in dialogue with the health department. And we'll also, most importantly, be on conference calls, several throughout the course of the week, where we're listening to different areas who are struggling, whether it's the hotel workers or the stadium workers or hospital healthcare workers or the trash men and women, or various different professions all across the city who are struggling. And so for us, we spend a ton of time working around the clock, listening to those concerns, dealing with those issues, helping Philadelphians to the best way we can, and making sure that resources are available for those who don't have it. So it's a very, very taxing situation that a lot of us have embarked on, and it's not just us as elected officials, it's people all across the city. And I think the thing that has been the most rewarding for me is the number of people who have stepped up to help people out, to volunteer, to give back, to feed folks in need, to donate their time, to donate their money. And that, to me, has been the most rewarding part, because this has been a very taxing situation. And I can only imagine what people are going through who've actually lost a loved one through to coronavirus. And so I just wanted to take a minute to talk about that. If anybody ever has any questions, you can feel free to reach out to us. But, you know, for the most part, a lot of the elected officials, our days start well before 9 a.m. We're on conference calls all day throughout the course of the day. And most of us are working because we're trying to bring the information to you even in the evening. With that being said, I just want to take a couple minutes to talk about the federal stuff, and then I'm going to close out. Real quick, some questions on Facebook. While my staff is commenting and answering a lot of the questions, so I see that they've done that for me. Thank you guys. I appreciate it. So whoever Judith asked about testing. Hey Judith, how are you? I talked a little bit earlier. I'm not going to dive back into it, but it fits into the transition, because the federal side is really where we're getting hurt right now. And so we want to increase our capability of testing. Judith, if you missed it earlier, I said that in total, we've tested a little less than 22,000 people in the city of Philadelphia. A little more than 9,500 have actually tested positive out of the 22,000-ish people that we've tested here in the city of Philadelphia. And we have a population of about 1.5 million. And so if we're going to really put ourselves in a position where not only can we flatten the curve, but transition back into some level of what the new normal will be here in the city of Philadelphia, we have to increase our ability to test people, and we have to be able to test people rapidly. So that's a huge issue, Judith. We're extremely concerned about it on the council level. It was literally something that was discussed on one of the many calls that we were on today. And I can assure you that, especially thinking about the Black community, we're really, really concerned, and we want to do anything in our power that we can do to bring those testing capability and those resources into the neighborhoods that need them the most. With that being said, why are we struggling with testing? Because we're not getting the federal support that we need. And so if anybody heard me earlier on a live, I said it once, I'll say it again. We need your help. Our job right now is to lobby the federal government and to encourage the federal government to provide more funding, more resources, more dollars for cities to be able to increase our testing, for cities to ensure that we have the essential supplies that we need for our employees on the ground level, those essential employees, for cities to make sure that their hospital and healthcare workers are protected. That stuff matters. I see one of my friends, June, he just logged in on Instagram. He is a mailman, and he works for the post office. We want all of those folks in the city of Philadelphia to be able to have the protection that they need for them to essentially do their job. Because if these people don't feel safe and they don't do their job, our city can literally crumble. And so it's imperative that we get the supplies that we need. Anybody who wants to take action, we implore you to lobby your federal government. Can I go to the school district to get a computer even though my child goes to a charter school? No. If your child goes to a charter school, you have to go directly to the charter school to get the Chromebook. And if you're having any trouble with that, please let my office know. And in the comments, they'll be able to help you with that. Outside of that, as far as lobbying, we've seen recently that Georgia is looking to open up. We also seen the beaches in Florida opened up over the weekend. And so, folks, just because that's what they're doing does not mean it's the right thing to do. Here in the city of Philadelphia, here in the state of Pennsylvania, our decisions are being led by science. Our decisions are being led to put us in a position to help save people's lives. I understand the economy. I definitely do. As a city, we're struggling on a consistent basis. Members of council were talking about the fiscal hit that we're going to have to take as a municipality. My team and I were constantly brainstorming what can we do post-corona to assure that fiscally there's some level of resources that's available and able to sustain for the entire city. And so when I think about where we are as a city and what we need to do, look, we know it's a difficult time. We know folks are struggling, and we know that there's a huge level of uncertainty. But it's important that we stick together. It's important that we stay positive, and it's important that we continue to be the good stewards that most of Philadelphians are being. I see somebody has a question answered. Okay, cool. So when we look at those decisions that other people are making all across the country, for us in Philadelphia, we cannot follow that. And so one of the reasons why I try to come live is because I understand that people need information from credible sources. And while I'm not a scientist, what I do is I collect accurate information, and I try my best to make sure that that is in the living room of everyday Philadelphians. And what you see going on in other states have nothing to do with the state of Pennsylvania, have nothing to do with the city, county of Philadelphia. Sylvia, what's good? How are you, sis? I seen your complaint about the homeless centers in the homes. We did ask the mayor's administration and the Department of Health about that issue on a call today. It was discussed, and we were told that that is being taken care of, and those folks should have all the protective supplies that they need. And so keep sending us that information, because as folks send us that information, that's how we make sure all our T's are crossed and all our I's are dotted. All that stuff really matters. If you tag us in social media, we'll try our best to answer. We can't promise, but that's why we give out our email and things like that, so people can make sure that they're able to get in contact with us. Keep doing a good job. Thank you. Thank you to all the folks who are, saying to keep doing the good job stuff. I definitely appreciate it. Anybody else with any questions, I'll make sure I answer them. But again, folks, I see it. The beaches are opening. It's tempting to go outside. And this is the thing. This is the thing that concerns me. So we do not have the ability to trace how someone got the disease, right? So hypothetical scenario, I'm tempted to go outside. You know what? I'm going to go outside. I'm going to go do whatever it is that I'm not supposed to be doing. I'm not going to practice social distancing. I'm not going to wear a mask. I'm going to convene with more than 10 people. You go do it, and it's like, boom. I don't have coronavirus. I don't have any symptoms of coronavirus. Maybe nobody texted me or told me that they have coronavirus or symptoms of coronavirus. So I think that there's no consequences for my actions. But what could have happened was maybe someone there did have coronavirus. Maybe they just don't show any symptoms because their immune system is strong enough. And maybe they passed it to someone else who also have an immune system strong enough to essentially not show symptoms of coronavirus. Remember, this disease, it spreads rapidly, right? It's very lethal and it's very dangerous, but it's very lethal and dangerous to a small percentage of the population. So when I give you numbers like only 9,553 people have tested positive in the city of Philadelphia, we know for a fact way more than 9,000 people have coronavirus, because we know for a fact that there are people who have the disease but just don't show the symptoms. So if you go to an event, maybe you contract it, maybe you're not showing the symptoms, maybe you pass it to somebody else, they contract it, they're not showing the symptoms. Eventually what happens is the virus gets passed to someone who has a weak immune system, who will show the symptoms, who will have some type of consequence because they essentially contracted the coronavirus. And you never realize that there actually were consequences for your action. So because you think there were no consequences for your action, then what happens? You continue to convene. You continue to not follow the guidelines because in your mind, oh, nothing happened the first time, I'm going to go do it again. We cannot trace how people are getting the virus right now because too many people are contracting the virus throughout the course of the day. So if we know that's the case, we're not sure if when you convene, did you pass it or not? We'll never know. Not anytime soon anyway. So when we're asking people to stay at home, when we're asking people to follow the guidelines that's being recommended as far as social distancing, only leaving the house when you absolutely have to, it's because of the position that we're in. We cannot effectively test yet. We don't have the capability. Because we don't have the capability, we're asking people to stay at home to limit the amount of people who contract the virus, to limit how the virus can be spread. And this is what we need to do in order to keep people alive. Those people who want to open up the economy, they're giving you a very clear message that money is more important than people. Money is not more important than people to me. If we have to spend 24 months instead of 18 months revising the economy, and we end up saving a few hundred or a few thousand or 10 lives, I think it's worth it. And that's the position that I'm taking, and that's most of the people who voted for me, that asked me to represent them here in the city of Philadelphia. That's the position they're taking. And so, again, when you see these places opening up, Georgia, the beaches in Florida, look, we're not in that position, and we're in this to focus on saving people's lives. This is a pandemic. We've never seen nothing like this in the history, in our lifetime. It's been 100 years since we've seen anything like this. So anything different than saving people, that's not the type of conversation that I'm going to be a part of. So with that being said, I'm going to finish this out just by answering a couple questions that people have on Facebook. And then once we're done that, I'm going to get ready to wrap up. So I see the question about city council. How? Somebody said, how did this thing come about? I mean, I can't really get into that. I do know that as a country, we're behind and we're unprepared because of the testing. And that is something that should have been led by the federal government. It hasn't happened. It didn't happen. And the fact that anybody believes that this is the responsibility of states and counties is flat out wild. And it just means that you listen to the lies that comes out of the White House. And it's literally killing us right now at this point. I appreciate the effort of City Council. Thank you. I'm not just here speaking on behalf of me. I'm speaking on behalf of my colleagues. This is a team effort. They know I go live. There's probably a couple of them that's logged in. Maybe I missed them being logged in, but it's definitely a team effort. Somebody has a question on Facebook. Go ahead and ask the question. I'll try to address it before I log off. The focus of switching from saving people to saving the economy. It's crazy. It's ridiculous how we just switched the focus to saving the economy from saving people. And let's not forget, folks, the federal government didn't shut the country down. The NBA did. Think about the fact that we live in a country right now where the NBA decided that things need to be shut down before the federal government did. So, that's a whole nother conversation. I could probably provide a dissertation on that. I think that's it, folks. I'm scrolling through. I think I've answered every question. I don't want to be too long-winded. Why are we waiting on federal government to provide testing? What can local government do to procure tests? So we're trying, right? As a city, we're trying to purchase tests, but tests are expensive, right? So at the end of the day, when you're looking at how much it costs a city to purchase tests and at what capacity would that hurt our budget as a city, especially if we don't know how long this is going to be, it's risky. We know it has to be done. And the federal government, they're not saying they're not going to do it. They're just lingering us along. They're stringing us along. We need them to move, and we need them to move now. We need them to pass a federal stimulus package that includes increasing our capability to provide testing. Think about this. If the federal government have the ability to provide $250 billion in relief to businesses, why would they not have the funding to be able to put us in a position where we can get the test that we need? Think about it. If they can give $250 billion to business, our budget as a city is $5.2 billion. They're giving $250 just to business. They can provide a few million, well, not a few million, but $1 billion worth of testing. They could allocate $1 billion to increase our capability to test. That's what I'm saying. So know that, yes, we're asking the federal government to do it because they have the capability. And if we take that hit as a city, it could end up having an economic ripple effect that I can't even anticipate what direction that will go in. Hold on. Is there ETA when the courts will open? No, not right now. We know that the governor extended the stay-at-home order to early May. As of now, we anticipate that. I personally anticipate that being extended again. So I would say not right now. If you have a pending issue, you should reach out to your lawyer. You should reach out to the courts. If you want to reach out to my office, we can help be a middle person to get you through this. I think I've answered everything, folks. Oh, do you think the information that we... Okay, so I think that's it, folks. I know some of my staff are answering the questions in the comments. I want to thank everybody for logging in. I'll be back next Monday. Hopefully, I have a treat with me next Monday. Hopefully, I will not be by myself. I am trying to put myself in a position to be able to bring you more information from not just me, but other elected officials. And I think right now it's very important that people get to know their elected officials. We are folks who represent you. We're trying to put ourselves in a position to advocate for more resources for you as Philadelphians. And again, my goal is for people in my listening audience to be able to know who these elected officials are and recognize, look, we're real people just like you are that's struggling to get through this process, whether you're talking about the mental health side, whether you're talking about the emotional side, whether you're talking about the economic side. We're in this with you as Philadelphians. So thank you, everybody, for tuning in. I'll be going live again another day this week to talk about The Last Dance, the Michael Jordan document, the Chicago Bulls documentary. And other than that, please, I'm here if you need me. Please stay safe. Please stay healthy. Call, check on your loved ones. It's not easy right now. So, again, thank you. Appreciate it. And everybody have a good night. Why can't we start? The comments are crazy as I'm signing off. Hey, Beth, what's up? Thank you. Have a good night.